And one of the first initiatives that I had was to get an idea of all the e-health activity that was happening in the Southeast LHIN. These views that you're going to see now, Alan Katz, I think he left, affectionately refers to as the WOW, or the whack of work. And it's looking at e-health initiatives that are between us, the e-health team, and other partners that are actively engaged in our LHIN. We have several provincial initiatives and several regional initiatives. I think our current count of projects under this is about 35 right now that are active. Todd and I are going to briefly discuss just 5 of our projects that are going forward and give you a glimpse of the future into the next 12 or 18 months. I'm going to have mapping in we're mapped at just 2012 as opposed to, but I guess orders start mapping. I'm going to quickly talk about what's called an implementation and adoption initiative in our LHIN, and also what's called the resource matching and referral. Doug Tessier talked briefly about people and processes this morning, and the implementation and adoption initiative is really about the people and the processes. When we started last year, we actually went through a readiness assessment for our LHIN to see how we were ready to deploy and sustain e-health solutions in the Southeast LHIN. From that, we moved into what's called the getting ready stage, where we actually moved into tactical planning to support those types of e-health solutions. We're now moving from the getting ready into the implementation and adoption. Through that process, we discovered that there were several areas of capacity building. Or remember the slide that Doug put up that this in your strategy, about those principles. What about building implementation and adoption initiative is that we need to develop capacity and be able to sustain in the areas of governance, project management, stakeholder engagement and communication, change management, privacy and security, and registration. And in the next 12 to 18 months, we will have initiatives to help us support that. As well, the Southeast LHIN has been identified to lead 2 provincial initiatives, one in the area of project management maturity modeling, so looking at where we are in project management and how do we baseline that and how do we move forward, and business integration. And this is building on the success of the Lean project at Brockville, so looking at Lean and Six Sigma methodologies and looking at true business integration of e-health solutions. So our LHIN will actually lead that for the 14 other missions. We will also be participating private prevention security initiatives in different management services. I think these projects will touch pretty well every and all healthcare providers in our LHIN. And if I missed anybody, I apologize. Why? And we come back around, this is to build those foundational priorities of the Ontario e-health strategy and help us build capacity so we can deploy and sustain e-health solutions. And then we will also have those frameworks, those tools available to the providers in our LHIN. Okay, and the second project I'm going to talk about is resource matching and referral, and I believe Doug talked a little bit about it, Paul talked a little bit about this, and I apologize for the slide, I fixed it, I don't know. But this is the what of this project. The province has identified a key priority. We've heard about emergency rooms, we've heard about ALC today, reducing demands on patient hours, increasing more effective capacity and possible rent appropriately, moving patient care. A key out of the end of the strategy is looking at tools, electronic tools that will support that movement of patients. What we're hoping to move from is the current state, which looks much like the spaghetti diagram, and moving towards a better patient flow. In the current project, the pathways that are in scope are looking at acute to rehab, acute to complex continuing care, acute to long-term care through CCAC, and acute to CCAC for in-home services. Eventually, it will be, patient to anywhere, but we have narrowed the scope of the project in order to deploy it. We are currently participating in a current future state with frameworks that are sharing, and ideas. So that's already underway. We'll be finished current state mapping at the end of January, moving to future state at the end of March, and looking at potentially RFP and implementation over 2010, 2012. Okay, why? Some of them were, talked about in the first slide. Supports patient, client-centered care, bringing the focus back to the patient. Matches clients to the most appropriate resources at the time of referral. And you can read all these, and Paul said the presentations will be available. There's actually, when we went through the benefits realization for this project, there's probably a collection of at least 30 benefits for this project. I'm going to turn over to It's all about
that gives 3 minutes to lunch. Okay, I'm just going to talk about 3 projects as well. I'm going to show, I think, yes, this is Paul's view of the HR, of the elephant, and talk about 3 projects we hope to do, we're planning to do, given funding approval from eHealth Ontario to start in the new year. Which are going to provide pieces of the elephant, so key building blocks. I'm going to look at first the clinical document repository, the purple box we've talked about already today. That's one we have on, in our plans. An e-referral application, particularly around regional surgical, but really again to provide that foundation that we can build on for all types of pathways. And another common assessment for the community mental health clinical story. We'll need another plan. And this is CDS in cooperation with the Champlain LHIN, so we'll be referring to it actually as the Eastern Ontario Clinical Document Repository. This is the application that allows us to share those hospital discharge summaries and related reports out with the primary care community. We mentioned some of the success we've had with point-to-point integrations. We've proven the benefits of electronic sharing of discharge summaries and other clinical documents. Today we've seen those point-to-point integrations and how they work, and we're seeing benefits in the community today. The CDR gives that system-wide approach to sharing this data. You can't sustain point-to-point over time. It's much more expensive, it's less efficient to do point-to-point. CDR gives us that system-wide approach to doing this and gives multiple points and